Let's talk about foreign bodies and really focus on esophageal foreign bodies. These are very often coins, so luckily we see them on the x ray, and they tend to get lodged in three specific locations: upper esophageal sphincter, the aortic arch, or the lower esophageal sphincter. Kids can be asymptomatic, or they might be drooling, gagging, choking, complaining of pain, complaining of difficulty swallowing, vomiting, any of the different things that you can imagine if there's a foreign body stuck in your esophagus. When you're looking at the chest x-ray, in general, if it is a coin and it is lodged in the esophagus, you will see it appear circular on AP or PA and on end on the lateral film. If you see the opposite, a coin that is on end on the AP but appears circular on the lateral, there's a concern that that might actually be in the trachea. In general, a symptomatic foreign body should be removed rather quickly if it's in the esophagus. If the patient's minimally or asymptomatic, that can be watched for 12 to 24 hours, and sometimes it will actually pass on its own, saving the kid an endoscopy at all. If the foreign body has already passed into the stomach, unless it's particularly sharp, particularly symptomatic, particularly long, foreign bodies in the stomach or the intestines can typically go home, as opposed to those in the esophagus that require admission. Now, there are a few special cases to be aware of, and the first one, of course, is button batteries. These are a huge issue no matter where you have one lodged: esophagus, nose, ear, aspirated, because they can start to cause liquefaction necrosis of the soft tissue around the button battery within 2 to 3 hours. So these need to come out, and they need to come out as quickly as possible. How do you know if you're dealing with a button battery? Sometimes you find out on your history, but most of the time it's going to be on the radiograph. When you look at that AP radiograph, you're going to see a double ring sign. It's going to look like a poker chip. Maybe at first you'll think, oh, that looks a little bit like a coin, but there's going to be a dark line just inside the perimeter of that coin-appearing object to let you know that it's a button battery. And if you look at it on lateral, there'll be a little step off, almost like two coins are placed not quite perfectly on top of each other. These are removed as quickly as possible. However, you can still see mucosal injury. There's a few new recommendations for button battery ingestions, which is if there's a delay to removal, honey or sucrafate can be administered to try to protect that surrounding mucosa. The other thing that needs to be taken out quickly, and this applies even if the foreign bodies are already in the intestines, is if a child has ingested not one but 2 magnets. And the issue with 2 separate magnets is if they attract, and there is intestinal mucosa, stomach mucosa, esophageal mucosa, anything between those 2 magnets, the power with which they attract each other can actually cause a pressure necrosis and perforation.